Hello, everyone, and welcome to this audio podcast. As part of a Phantom edition, this audio podcast, as part of a Vertex Roulet, this audio podcast, as part of a Lobostics Machina, and this audio podcast, as part of a Cyclone Bonus 3. This audio podcast, as part of a Cyclone Bonus 3, and this audio podcast, as part of a Storm Lobostics production. In works that have been published in around 2021, 2022, around that sort of time. Around that sort of time, this in around that sort of time where works in regard to a need for service evaluation for young people suffering with chronic kidney disease, CKD, where published works was collaborative and where published works was collaborative. In this audio podcast, I look at works that have been put forward as a research poster presentation and as part of the remit in regard to the European Working Group for the psychosocial aspects of children going through chronic renal failure, or chronic kidney disease, in as part of the meeting that took place under the remit as part of the remit, the EWOPA 2023. And where this works where the research poster presentation looked at an overview of and in regard to service evaluation in young people suffering with chronic kidney disease and CKD, and this research poster presentation was collaborative between two social media platforms, and three academic institutions, in the United Kingdom. And so and so and so To begin with, some intro as part of this audio podcast. So, health economics plays an increasingly important role in the assessment of cost effectiveness in healthcare, providing input into health tech assessments and clinical guidelines developed for clinical commissioning groups, or CCGs. To inform listeners out there that clinical commissioning groups, or CCGs, have sort of changed sort of where CCGs are now believed to be referred to as clinical as commissioning care groups. The clinical aspect of the remit around clinical commissioning groups is believed to be in more sort of recent in more recent evidence on the clinical sort of aspect or basis of CCGs has been omitted. So now, typically, it has proved challenging to assess the cost effectiveness of services for younger patient groups younger patient cohorts or recipient cohorts due to the lack of data that would typically populate economic evaluations. And while society may, on the one hand, value treatment priority for young people, a more thorough evidence base is required or is needed to support their care. Treatment costs for young people with CKD or chronic kidney disease with chronic kidney disease are not a trivial matter, and evaluation of the costs and sort of advantages in an economic evaluation framework could aid decision makers as to how best to treat those in this and amongst this cohort. So the paper, the research poster presentation looks to provide a bit an underpinning in regard to in regard to where in regard to where in regard to where the where sort of evaluation for young people suffering with CKD or chronic kidney disease is required. Before going into the main aims and objectives around this research poster presentation, also looking at sort of young people's services and in regard to the challenges. So healthcare is moving toward, or has been moving towards, self-care and self-management to ensure young people are included and receiving the right service or services. Healthcare professionals themselves need to ensure they know what patients or recipients want or require in regard to care. In addition, the proliferation of tech advances means that there is now an increasing requirement or need to ensure tech is available to better integrate services and to allow delivery of clinical care for patients or recipients are suffering with long-standing or long-term conditions. Funding restraints has meant healthcare professionals are also working more to involve patients. Have been working more to involve patients or recipients and the public in research to bridge gaps in amongst aspects of clinical and amongst medical care. Now looking at some retrospective data, where retrospective data have been collated through the UK Renal Registry or UKRR. So a total of 917 children or young people aged younger than 18 years younger than 18 years with established renal failure or ERF have been receiving treatment at pediatric nephrology centers in around 2014. At the census date, around 31st of December 2014, 80% of recipients or patients aged 18 years had a functioning renal transplant. 11.2%, or just over 11%, were receiving hemodialysis, and 9.5% were receiving peritoneal dialysis. In patients or recipients aged 16 years, prevalence of ERF or end-stage renal failure was just over 60 per million aged related population. Per million age related population. In the UK, for example, the United Kingdom, in around 2013, the prevalence rate of treated end-stage renal failure or ERF in young people aged less than 16 years was just over 58 per million age-related population, and the incidence rate was 9.3 per million age-related population. There are or were 1,656 young people aged less than 16 years who had received renal replacement therapy, or RRT, and that is, for example, hemodialysis or renal transplantation, in the United Kingdom. In the United Kingdom between 1999 and 2014. Analysis of CKD demographics for young people aged less than 16 years revealed that 547 patients reported to the pediatric registry between 1998 and 2002. B, 536 patients reported to the pediatric registry between 2003 and 2007, and C, 573 patients reported to the pediatric registry between 2008 and 2012. UKRR data informed that 891 young people aged less than 16 years were receiving a renal replacement therapy, or RRT, in the United Kingdom in around 2013, and this indicates that CKD has become an increasing issue in young people, and thus there is a requirement or a need for service evaluation to address challenges. So now looking at the sort of the aims and objectives as part of this research poster presentation and as part of this Cyclone bonus 3. So the authors present data. When the authors present data in around the UKRR to investigate how service evaluation and pediatric health practices can be enhanced through a better understanding of clinical care networks. One such example, has been or examples have been through, for example, social media platforms such as the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS group for kids, where service providers and service users have more shared discussion about and participate about and have shared discussions about and participation in regards and relating to healthcare. So now looking at some data as part of this research poster presentation. In regard to the need for enhanced CKD service evaluation, and where data looks at pediatric nephrology and young people services. So there has been a fragmentation of services between centers. So whilst one center may provide most young people services for CKD or chronic kidney disease, another may only offer limited services. The delivery of services can also depend somewhat on where a young person lives, which is reflected by the investment and priorities of that area, making it a challenge for young people to receive the best care. And some of the data or some of the literature in regard to this is from and has been from the Royal College of Pediatrics and Child Health in the United Kingdom in works from around 2000 from around 2011. Now, acute kidney injury, or AKI, for example, has affected more than 1 in 5 emergency hospital admissions. 1 in 5 emergency hospital admissions, for example, and AKI survival rates have improved in young people over the years from 9 out of every 100 in 1999 to 2003 to 18 of every 100 to 18 out of every 100 in 2009 to 2013. Early service evaluation could help save up to 105 million adult and young lives per year globally. Some patients or some recipients with pediatric renal diseases or conditions reported high incidences of renal dysplasia, for example, or reflux in around just over 34%, obstructive uropathy just over 18%, and glomerular disease in around just over 10%. These were the most common sort of listed renal conditions or diseases for young recipients aged 16 years old with chronic kidney disease or CKD or forms of CKD, and accounted for just over just under 63%, 62.9% of all patients or recipients from whom a primary diagnosis had been reported. There are significantly lower rates of preemptive transplantation in females, in girls, and ethnic minorities, and further studies or investigations, further investigating this, for example, would be of great value. Fewer young people than adults have CKD, but inevitably the care pathway also involves hemodialysis, for example, peritoneal dialysis, or transplantation. And in addition to CKD, 1 in 3 young people have other diseases or conditions that thus making care more complex. Out of every 100 young people, 75 will have at least one risk factor for stroke, for example, for conditions around stroke or cardiovascular implications, whilst 10 out of every 100, 10 out of every every 100 will have 3 or more risk factors. Now, looking at as part of this research poster presentation, looking at some preliminary aspects of of young people's looking at young people's care. Some preliminary aspects around young people's care. So the present backdrop of young people's care is defined by a relationship between tertiary centres and other NHS trusts, for example, and providing young people's services within a geographically defined area. A British Association of Paediatric Nephrology, or BAPN, survey undertaken in around 2009 of tertiary centres and general paediatricians, identifying that 13 tertiary centres received patients or recipients from over 200 paediatric departments. Each centre was linked to between 7 to 20 hospitals. In regard to networks and commissioning, understanding sort of the understanding costs and advantages of where value can be added in the care for young people with chronic kidney disease (CKD) will and could aid both service providers and decision makers with how to provide and or integrate the best care for this cohort. Research has been developing on how best to detect CKD in young people, looking at which recipients or patients are affected and what the optimal monitoring intervals are between, for example, blood tests and optimal monitoring intervals but between blood tests and when in the right time for referral to specialist centers. Future research will also require to identify the skills, competencies, and added value to support recipients or patients who have CKD or chronic kidney disease. The poster presentation, listeners, also has a look at social media platforms research in context of research and awareness, and just to provide a quick look over in regard to sort of social media and opportunities for healthcare sharing. So the social media platforms, within the research poster presentation, there is an overview that looks at sort of the overview in regard to social media, different social media platforms, and how different social media networks, for example, and how the two social media platforms, RPSG and KDARS, for example, utilize the social media networks. So, for example, in regard to Facebook, a general description is where there were, at the time of this research poster presentation, at the time of this research poster presentation in around 2023, the RPSG had three Facebook groups, including one admin and moderators group, including one admins and moderators group, and at the time, KDOS platform had near 2,000 service users, healthcare service users internationally since 2014. The RPSG had just over 2,000 healthcare service had just over 10,000 healthcare service users internationally and globally since in around 2009. In regard to Twitter, for example, the Twitter there at the time of this research poster presentation, the RPSG had over 2,000 just under 3,000 tweets representing nephrology in healthcare since in around 2018. In regard to ResearchGate, there were two ResearchGate pages, and on KDARS, there are over 60 research items or publications surrounding pediatrics and young people, and on the RPSG, there were over 300 research items and publications surrounding science and nephrology. On Instagram at the time, there are over 1,200 images, posts, and over 70 video posts representing nephrology and healthcare since 2012. On YouTube, on the YouTube network, there have been two YouTube channels. One channel which had over 80 educational videos, and one channel that had over 20 audios on podcasts representing nephrology and healthcare since 2019. In regard to SoundCloud, there was one SoundCloud channel with over at the time of this research poster presentation, there were over 40 audios and podcasts representing nephrology and healthcare since in around early 2023. And finally, a blog spot or blogger which had over 200 journal posts representing nephrology in healthcare since 2012. So now looking at some overall conclusions as part of this research poster presentation. This research poster presentation put forward for the EWOPA 2023. Is for EWOPA 2023. So many young people with CKD require complex care or advice regarding specialist health requirements. Close liaison between pediatric renal science and primary care practices would hopefully or should hopefully help facilitate better delivery of care. However, adequate staffing and training is an ongoing issue, along with inadequate investment and cuts to healthcare services, and increasing pressures on staff time. With all these issues, there must now be sort of an evaluation, or a robust sort of evaluation, which puts patient care at the heart of services. The use of social media and mobile health could help achieve this, creating better access to patient groups or cohorts, and a more informed service delivery. And whilst pediatric renal teams do make valiant efforts to know when and how young people with CKD may benefit from alternative treatments or care pathways, there is a need for good examples in practice, so colleagues can see firsthand what best practice looks like and learn more effective ways to demonstrate and document evidence-based practice, and highlight gaps. So this is highlight service gaps, or healthcare service gaps, so this is better understood. The research poster presentation has acknowledgements, in regard to where specialists, where sort of specialists in amongst the specialty has sort of strived to ensure has sort of strived to ensure sort of best in regard to best practices, if not excellence, in regard to pediatric nephrology, and additionally, there are some special sort of dedications, or in context of remembering some who've lost their lives to particular and specific forms of chronic kidney disease, to particular and specific forms of chronic kidney disease. That draws this audio podcast to a close. This audio podcast as part of a Phantom edition. This audio podcast as part of a Vertex Roulet. This audio podcast as part of a Cyclone bonus. A Cyclone bonus 3, and this audio podcast as part of a Storm Robotics production.